Good morning, everyone. Thank you for joining us for Recovery is Good for Business. My name is Liz Haddad, and I am the Central Mass Opioid Task Force Coordinator for District Attorney Joe Early. District Attorney Joseph D. Early Jr. has been District Attorney in Worcester County since 2006. He's been a leader and innovator in the prevention and intervention of substance use disorder since he was elected, and he's been a great champion of folks in recovery.
Good morning. Thank you for being here today to discuss this important topic. Over the last couple of years, we've all been so focused on the global pandemic that impacted every aspect of our lives. As we continue to work through this pandemic and move back to some sense of normalcy, we have to continue working to address the other health crisis plaguing our society, and that's the opioid epidemic. We lost more than 100,000 people to overdose deaths. That's the highest death rate our country has seen in the opioid epidemic. It's devastating. Now we have more overdose deaths than car crashes and gun deaths combined. Many of us know someone or a family who is still suffering from the disease of addiction, and it's a horrible disease. You may be wondering what addiction and recovery could have to do with your business or businesses within your community. That's a good question, because what you may not realize is that 2/3 of the people suffering from substance use disorder are currently employed. That means you likely have staff who are suffering and need your support. They need your help. We'll talk more later about what the specific supports look like, but for now I'd like to talk more about the disease of addiction itself. And it's a very complex disease of the brain. There's a stigma out there that it's a moral failing, a moral leprosy, but it's a chronic disease of the brain that can be effectively treated. And in this video, Director of the National Institute on Drug Abuse, Dr. Nora Volkoff, will explain further the process of how substance use disorder rewires a person's brain and what addiction is.
So you have, on the one hand, this system that's pushing you towards wanting to get the drug, and on the other one, the other system that is not able to break in the strong urges to take them. And that's why the analogy of pushing on the accelerator without brakes is a very good one.
When opioids bind to specialized receptors in parts of the brain, they trigger the same processes that reward you with natural feelings of pleasure from activities like eating and socializing, but they deliver that much more intensely. They make a chemical messenger called dopamine surge into certain brain circuits. That encourages more drug use. Eventually, these surges can happen when you just encounter people or places or things associated with opioids. That can produce craving. Other brain circuits adapt to opioids, but that means that without the drug, you feel jittery and anxious. That can contribute to withdrawal. Repeated use of opioids changes still other brain circuits, making you more sensitive to stress and negative emotions when the drug wears off. So you take drugs not so much to get high as to escape feeling low. When opioids hamper your self-control, it's harder to stop using them, even when they don't give pleasure anymore. Here's another way to look at the addicted brain. It's like driving with bad steering.
Your steering wheel does not work properly. So not only you are actually accelerating with intense desire and motivation to get the drug, you are not able to self-regulate and say, if I take the drug, I'll end up in jail. But you don't have the capacity to steer yourself to another behavior that could help you overcome that intense desire for the drug.
Dr. Volkoff described many barriers to treatment in that video, including physical and psychological issues. The important thing to remember is that substance use disorder is treatable, and people can and do regularly recover and enter long-term recovery. There's a great success rate with this. One of the biggest barriers to treatment, though, is the stigma that is attached to substance use disorder. The doctors who study addiction all tell us that eliminating the stigma opens the doors to treatment, the barriers to recovery, and starts the healing process. Addiction costs all of us, from the loss of a loved one to the prices we pay for good. It is everywhere. And the University of Pennsylvania health system estimates that drug and alcohol addiction costs industries $100 billion a year, mostly due to lost employment and a reduction in productivity. The more we can all help those with substance use disorder, the better off our entire community will be. We need to show empathy and compassion. We need to remember that the people who are suffering aren't junkies, losers, or whatever derogatory term you might hear. They are our sons and our daughters, our mothers and fathers, brothers and sisters, our employees, co-workers, friends, nieces and nephews, people that we care about. And we need to treat those who suffer from this terrible disease with compassion and empathy. And we need to talk about substance use disorder as this treatable and preventable illness that it is. Stigmatizing addiction only prevents people from getting the help that they need. So within your workplace and community, you can encourage safe use, storage, and disposal of prescription drugs to help eliminate the supply of these harmful drugs and prevent their misuse within the community amongst your family members. Every workplace should be prepared to deal with overdose emergencies by carrying Narcan and training staff how to use it. Narcan is a miracle drug used to reverse overdoses and literally save lives, and there's no side effects. Make sure to have substance use disorder mental health treatment information and resources available and accessible to staff. Beyond helping those currently in active addiction, it's also important to recognize that recovery is possible and people aren't defined by their diseases. We often hear from experts in the recovery community not only how important employment is to sustaining recovery, but also what great employees those in recovery actually make. Since employment is so important to someone suffering from addiction, they bring a heightened level of commitment to the workplace and the community as well. They want to make this work. So think about using a recovery-informed approach when you consider new hires. Also, be mindful of those who may be suffering when planning company social events. Addiction is a community problem that requires community solutions. We're going to do a demonstration with the website to show you the financial impact that your industry can face due to substance use disorder. It's amazing.
So that was an excellent presentation from the district attorney. And now, as he said, we're going to use an employer cost calculator from the National Safety Council to give you an idea of what substance use disorder, how substance use disorder could be affecting your bottom line. And I have prepared a report in advance, just in the interest of time. So I based this report on a Massachusetts business in the entertainment and recreation industry with 35 employees. When you go to this link, you can customize it for your business and get a detailed cost analysis for your business. When you look at these costs, and this is a very detailed report, it really does show you why it is so important for businesses to support those in recovery and who need substance use disorder treatment, sorry. So there's a number of different places where you can access more resources in this report as well, including this one, which is great. This form will give you access to a free employer toolkit that can really help you when you're addressing substance use disorder in your business. There's lots of, there's videos, there's sample policies, posters, all kinds of stuff that can be very helpful when you're addressing substance use disorder in your business. And now I would like to introduce our next speaker, Amy Leone. If you are from the Milford area, I'm sure you're very familiar with Amy Leone's work. She too is a longtime leader and innovator in the prevention and intervention of substance use disorder. She is the director of Community Impact. She is the director of the Regional Substance Navigation Program, and she is the director of Chris's Corner Recovery Resource Center. So she wears a lot of hats. She does some amazing work. And before she gets started, I just want to quickly mention a little bit about Chris's Corner. Chris's Corner is a resource recovery center on Main Street in Milford. And it's really the result of an innovative collaboration between the Office of District Attorney Joe Early and the Regional Substance Navigation Program. Chris's Corner is funded with a $1.1 million grant from the Department of Justice through their Bureau of Justice Assistance programs. And honestly, Chris's Corner is just an amazing example of what can be accomplished when community members and stakeholders really work together and think outside the box to provide needed resources and get the funding for those resources in their community. So with that, I give you Amy Leone.
Thank you, Liz. So what I'm going to kind of start with talking about is kind of where this all started and to understand a little bit about the Regional Substance Navigation Program. As Liz had said, I've been in this community for over 20 years doing a lot of different programs to really address the current needs of our regional community. So if you're familiar with Milford, Milford is kind of the bigger town of the smaller towns, being Mendon, Upton, Hopedale, and Bellingham is large too, but we are surrounded by that. So about 20 years ago, I had started the the Juvenile Advocacy Group, which is a regional coalition with all the towns and different partners to really address the underage substance use and look at prevention. And so we've been able to make remarkable differences with prevention of substance use in regards to drinking and other, illegal substances. Now we still work on the vaping and marijuana use as a continued preventative measure through our juvenile advocacy group, the coalition that meets still to this day every other month to address those needs and talk about what's going on in the community and what we can do to make a difference. So under the leadership of Milford's former police chief, Tom O'Laughlin, him and I have been working together for many, many years. And what we were starting to see is some of our clients that we had worked with when they were juveniles in regards to the juvenile advocacy group and our programmings that we did, we were starting to see, obviously, they were getting older and they were starting to become addicted to opioids and to heroin. So we looked at each other and said, what is it that we can do? We need to get in front of this before anything happens. So we developed the Regional Substance Navigation Program that was a direct linkage. It was a four-prong approach, really looking at providing mental health therapists with the police departments to be able to respond in the moment at an overdose or an overdose accidental death, or if a family was struggling with it and they had reached out to the police. So we have continued for the last 6 years to do that four-pronged approach with the police department and the community, with the intervention, the treatment, the follow-up, and developing those strong community partnerships. And so we continue to do that, and we have been extremely successful, which I can, go on to kind of talk about, when we look at what is the regional substance navigation doing, in this moment right now in 2022. And I'll go into kind of our history in a little bit, but just to give you an example of how prominent this issue is within our regional communities, in January of 2022, we, had interaction with 149 individuals and families. Moving into the month of February, we blew out the water where we had 450 individuals and families that reached out to us for individual, just support, whatever that may have been. From those numbers, from the 450, we were able to get 103 people into therapy and recovery support through our recovery coaches. And that, just as we all know that mental health and substance abuse is such a huge issue, that and the demands of these services are astronomical, and the wait list, that to know that we could get 103 people into services within 1 month is, a pat on the back for all of my staff that is working here so hard. Within that 450, there was 40 families that we were actually able to help because they had a loved one or, a significant other that was struggling from substance abuse. So kind of like, how is this all possible? How are we doing this? Liz, you can kind of go to the next slide if you want. The question was when the former Chief O'Laughlin and I sat down and we talked about the fact that, substance abuse is not just a police problem. It was always looked at, this is a police problem, this is this. And, we together, we felt that this is a community problem. And unless we address this as a community initiative, then we're not going to have the buy-in and help to reduce that stigma that is out there in the world. So what we did is we really looked at, we have always been very innovative in what we're trying to think about. So in 2017, we all got together, those regional towns, Milford, Mendon, Upton, Hopedale, and Medway, and we successfully all petitioned to our select boards with a special line item that said appropriate $1 per resident based on 2010 census to be placed in a revolving account. That meant that it didn't need to be used every year because maybe it wouldn't be needed, but it was used to maintain those substance abuse outreach efforts so that we could really buy into this as a town initiative. And so I have to say that, this has probably been the most innovative and successful thing where it buys into everybody, realizing that we're together in this problem. And so we have always, I think it was a practical approach because everything that we have done in our communities has been really looking at it from a family oriented position where we are all in this together. Nobody can raise any, it takes a village to raise a child, and we are all doing this together. And that has been our approach the entire time. So any other, communities that have been interested in wanting to do things like this, we definitely would be open to outreaching and talking about how did we do this? What is the language that you needed? And how can we get this started with, such a line item like this? So as we kind of look at our community efforts, our awareness and our efforts and our results, we do this on a monthly basis. Nothing would be possible without the staff that I had that are so dedicated and genuine. Our mission is, no judgment, no shame, just truth. And I have to say that that is the backbone to our programs all around, is that we approach these problems as, an individual. We approach them genuinely. Every case is different. We are here empathetically with compassion to listen, because the way that I have always viewed my work that I do as a mental health therapist or innovating these programs is that when it is if, and God forbid, it was my child or my family member, I will not have the answers, and I will need to rely on somebody like myself to help me through these struggles. And I was taught as a very young kid that you treat somebody the way you want to be treated. And I ensure that all of my staff are able to do that and when they start to get, as we call, crispy, we really look at how do we take care of ourselves, because in this field, that is an extreme thing that we need, that self-awareness and self-compassion, and we really need to do that. So when you look at these numbers, we were looking at, okay, in 2021, we have one death, and one overdose, and then we bring it up to 48 overdoses, 3 deaths, and then in 2020, we have 42 and 2 deaths. So we were really seeing this trend of what we needed to do. Thankfully, with all of our efforts, we're able to reduce some of those overdose, unexpected deaths. Right now in 2022, because we do keep track of all of our regional, all of our communities overdoses. There's a program with the district attorney's office through SIMS. So we're able to show, the overdoses and the follow-up that we have so that it is tracked to see what is everything happening. But one of the things is that when we're looking at this, we saw that we were making efforts in regards to the heroin and the opioids problem. But what we were seeing, and the common thing that you hear from many people who are in recovery from heroin or opiates, is alcohol was never my problem. So then they start drinking, and that becomes uncontrollable. So years ago, we started to track the alcohol use, the protective custodies, the OUIs, things like that. So right now in 2022, we have had 10 overdoses within our communities and 3 deaths. What we have been tracking is that within these 2 months, we have had 24 alcohol-related incidents. Unfortunately, within those 24, 13 of them were from the same individual that we are working with. So, you do see that even if you're given this, you have to want to change. So we continue to work with people even after 13 incidents with the same person within a 2-month period. So Liz, you can go to the next slide. So one of the things that we set up with the Regional Substance Navigation Program was that every time that there was an overdose we would get, myself and one of my other staff members, we would get paged in that moment so that we could reach out to the responding officer and we could go to the hospital or we could meet that person, whatever it was that we needed to do in that moment. Over 2021, I, kept on getting the pages, and the pages were all happening at the hotels within our area. So we decided in August, we came together as a police department and said, we've got to do something about this problem. We cannot let this continue. This isn't good for their business. It's not good for the community. So we brought all 6 of those hotels together and said, listen, we are here to work together. What can we do? How do we do this? In 2021, we had 49 incidents at our 6 hotels. And so we added a police officer, Officer Crossan, who has been absolutely amazing. He has gone to the hotels, build relationships. He's been there doing some details, just being present in the area, letting people know. And we had, after we implemented that in August, we only had 13 incidents. So we had dramatically reduced some of that. When we look at what have we done now in 2022, as we're about 6 to 8 months into this, we have only had 5 alcohol-related incidents, and we have had 2 overdoses. So we have dramatically changed that mentality within the hotel. So we are so thankful for our relationships with them and the community that we've built to be able to really work together, and for Officer Crossan to really step forward and take that initiative. So that's something we will continue to do, because there is always things that we need to change and help in that area. We can go to the next slide, Liz. So this is Chris's Corner. That is where I am right now. It is at 12 Main Street. This used to be my old community impact office. But so we are here now, Chris's Corner. It is a outreach. It was dedicated to one of our individuals, Chris Swindell, and his parents are extremely involved in this and they hold a lot of groups here, which you'll see in a little while. One of the things about, we really offer that recovery oriented services, support, resources, really to help people live that self-directed life and reach their full potential, whatever that may be. We are not ones to decide what somebody's, path to recovery is. Many of our services are skill-based. We have a case manager that will help with insurance, will help with housing. We have a peer support specialist that helps on the mental health side, helping people, get their, wellness recovery plans. We have recovery coaches and mental health therapists that are here for individuals. Just to give an overview, in the month of February, we were able to outreach to 95 individuals just through Chris's Corner. 81 of them were actually individuals that we provided services to. We put 2 people, we track, when they go into programs, we track, how are they doing, what happens after the 30-day follow-up or 5 days, we're providing that recovery and therapy. So, we are definitely seeing an influx of people that we are able to help from all walks of life. So we can go to the next slide, Liz. We have walk-in hours every single day. They're from 10 to 2. Those are when anybody can walk in and get some of the services. Outside of those hours, we are open in the evenings for individual, recovery coaching or therapy, or group therapy, whatever that may be. We do run on a hybrid model, so some of our groups are still Zoom and in person. Some of our sessions are that way, just depending on what the comfortability is of our clients and those that we serve. We can go to the next slide, Liz. So this, even though it's small, this is our monthly calendar for the month of March, but you can see that every day is jam-packed with a bunch of different things. When we decided as a program, what do we want to offer? We want to offer people skill-based groups. So we have art, we have yoga, we have, more of the evidence-based curriculums. We have how are we letting go? We have women's groups, men's groups, things that are really pertaining to everybody, no matter what your walk of life is. We have a virtual, a weekend planning group. So it's held on Thursdays, and Brittany runs that. She's our certified peer specialist, and she helps you to understand what obstacles are you going to come into over the weekend that we can help you so you don't get into relapse, or how to calm yourself down, or get yourself out of a situation. We do book clubs, and they're not book clubs they're more about self-help. We do a walking group, we do things just to get people out. We have a garden, a community garden that we work on. So we really look at all different modalities of treatment and skill-based, so that it can be eclectic to any person, no matter what they need in that moment. We have a Facebook page that is just like, we put so much stuff on the Facebook page. We now have an Instagram page. Our website is absolutely beautiful. One of our staff developed it, and she learned from the bottom up, and she did an amazing job. So, that if you need to check that out, please do like the page, follow it, things like that, because you'll get a wealth of information. So that's, that's just a little bit, and you can go to the next slide, Liz. So this is just kind of showing what success we have had, combining the regional substance navigation program with Chris's Corner. And, we were able to, when we look at 2020, we had 2,312 people that we were able to outreach to and provide services to. Looking at 2021, we doubled that. And, we expect that we're going to be able to double this even more. One of the things as we look at moving forward, like, okay, we have this now, what are we missing? What are we missing in this grand scheme of things when we are looking to help different, businesses or organizations or people or family? What is it that we need? So we will be developing, an intensive outpatient program so that we can have those services here. That was funded through an earmark that with the support of our senator and representative, we will be able to provide that to those people in this area. So we're always looking at different things that need to happen. Where are we lacking, and where do we need to go? So that's just a little bit, and we are here to provide help to anybody in the community that needs it, especially with businesses. And many of the Milford businesses have already reached out for support because we've been here for so long that the trust is there to help other people. So that is a little bit just about our program. If there is more information, you can always reach out that you need or questions. But what I'm going to do is I'm going to turn it over to Audrey. And so Audrey is from Program Rise, Audrey Lambert. She's from Program Rise, which is a program of JRI Health. And we have partnered with them since the very beginning of opening Chris's Corner. And we run monthly, every Tuesday, the first Tuesday of every single month, we run 2 ongoing virtual Narcan trainings. As we feel that this is the most important thing to helping save lives, we've been able to partner, and we have trained tons of people for it with Narcan. Recently, over the past month, we've been able to partner again together to really to create community packets for the members and individuals in the community that may be struggling with the substance abuse, and provide them with Narcan and provide them with the way to save a life and have it in their house. So that has been absolutely amazing collaboration through the whole time. So I am going to, Audrey is the program manager of the syringe service program, and that is out of Framingham. And so I'm going to turn it over to her to do a little bit about Narcan training as well, and how that can help with your businesses. It's all you, Audrey.
Thank you so much, Amy. And thank you so much to the District Attorney and to Liz and Julie for having us here today. Yeah, so like Amy said, I work at Rewires in Framingham, and we do these sort of overdose response and Narcan trainings all the time. So I don't want to invite folks to please feel free to use the Q&A, like throw in questions as they come up. And Julie, you can feel free to interrupt me if there are things that come in. So can we scoot over to the next slide, please? So basically what I'll be going through today is I'll be talking about what an overdose is, how to recognize one, what Narcan is, how it works, and then really like what to do if you do find someone who you think is having an overdose. So what is an opioid overdose? So quite simply, an overdose happens when someone takes more of an opioid than their body can handle at a time. The main thing that we sort of worry about and sort of the classic thing in an opioid overdose is respiratory depression. So meaning that person stops breathing, which is obviously a big concern. We want to make sure that our bodies and brains are getting oxygen. So this little graphic right here, the text is a little bit small, but it sort of highlights the main signs of an overdose that you can recognize. So the big one is really someone is not responsive. So you call their name, you tap their shoulder, they're not responding to you, they can't be woken up. Slow or no breathing. They might be making like choking or gurgling sounds. Blue lips or nails, which is an indication that they're not getting oxygen. Their skin might be cold or clammy, or they have small pupils. The ones that I have sort of in this red box here are sort of the big three that I look for as far as like not responsive and not breathing. And one other good way that you can check for responsiveness is what is called Astronomy Rub. It's really easy to do. So you make a fist with your hand, and you're going to take your knuckles right here and rub them on that big bone in someone's chest right here, their sternum. Just give it a good quick rub. That's, you don't want to be breaking skin or anything, but it's basically enough to try to stimulate someone. If someone is responsive, they'll be like, hey, what are you doing? Get off of me. And if they're not responding to that, it's a good sign that you are in some kind of emergency. Next slide, please. So we talked about what an opioid overdose is. The other word in my title is Narcan. So Narcan is the brand name of this medication. The generic name is naloxone. I tend to use Narcan throughout this training because I think it's just a little easier to say and to remember. But Narcan is a non-harmful medication that suspends an opioid overdose. And you'll see I've underlined non-harmful here because I think this is a really important point. Narcan has one job. All it does is suspend an opioid overdose. So if you're in a situation when you're not sure if someone is having an opioid overdose, something else might be going on, it is perfectly safe to give them the Narcan. It's not going to have any effect on someone who's not using opioids. They're not going to get high. They're not going to get addicted to it. It's not going to hurt them in any way, which is why we really encourage folks to carry it with them. So Narcan is available at pharmacies in Massachusetts without a prescription. So it's pretty easy to get. You don't need ID. It can be a little pricey. It's about $130 without insurance, but it is covered by most insurances at little or no cost. I know it's covered by mine. But if that's ever a barrier, it is also available at most harm reduction programs for free throughout the state, including Rewires. And I will be putting like my contact info and stuff in the chat as we get to the end. So you can always reach out to me if you're like, hey, how do I get some of that for my first aid kit at my business? Next slide, please. So in that video that the DA showed earlier, it was a really nice sort of explanation of how opioids work in the brain, and I'll sort of add on to that as far as how Narcan works. So like the video mentioned, opioid molecules bind to specific receptors in your brain, which releases dopamine, which, gives you all the good feelings. Basically, the way that Narcan works is when you give someone Narcan, it comes in and it pushes those opioids off of those receptors, right? So when someone's having an overdose, there's too many opioids bound to those receptors. That person stops breathing. Narcan kicks them off the receptors. They should be able to start breathing again. It suspends that overdose. So this is exactly why it doesn't have an effect on someone who's not using opioids. Although the Narcan binds to those receptors, it basically just blocks the opioids from getting on. So it's not going to have any effect. It doesn't do anything. It just blocks the opioids. Narcan, I say it suspends an overdose. So it tends to suspend an overdose. It lasts about 30 to 90 minutes, so an hour, give or take. Opioids can hang out in the brain longer than that. They tend to stay in the system a little bit longer. So if someone had taken a lot of opioids, or if they use again after they've been Narcaned, once that Narcan wears off, it is possible for them to fall into an overdose again. And I'll get to this a little bit at the end, but that's why we really recommend that if you are with someone who's experiencing an overdose, one, definitely want to get them medical attention so that they can be monitored and make sure that they don't overdose again, or at least hang out with them for a couple of hours, encourage them not to use again, because that Narcan does wear off. You might have heard about this. So the person may experience withdrawal symptoms after you give them Narcan, because it is, taking the opioids off of those receptors. The video earlier did a nice job of explaining what some of those symptoms might be. They might feel physically sick. They might be nauseous. They might feel really anxious or angry. But those symptoms will wear off as that Narcan wears off. So really just, wanting to be kind and let the person know what's going on and that they will feel better once that Narcan wears off. The last note that I have here is that expired Narcan is better than no Narcan. So Narcan does expire every 2 years. So, if you have one in your first aid kit at the office, definitely good to check on that periodically and get some new doses if your Narcan is expiring. That's all you have on hand. DPH says absolutely, better to use that than nothing at all. It might just be a little bit less effective. Next slide, please. So this is a lovely graphic from DPH. So this sort of gives like the general overview of how to respond to an overdose. And then in my following slides, I'll go in a little bit more detail about each of these steps. So really 4 steps here. First thing you're going to want to do is call 911. You identify someone, they're not breathing, they're not responsive. You're going to call 911, tell them exactly that. I'm with someone, they're not breathing. I think they might be having an overdose. You want to stay with them until EMS arrives. If you're in sort of a place of business, maybe asking one of your coworkers to go down and help them find where you are. Always want to make sure you tell dispatch your exact location. Are you on the 3rd floor? Is there a code they need to get into the building? Make it as easy for them to find you as possible. Once you call 911, you're waiting for EMS to arrive. You're going to want to give them the Narcan. We'll talk about that in my next slide. While you're waiting for that Narcan to work, you can give rescue breaths or CPR, again, to make sure that they're getting that oxygen to their brain. And then stay with them until help arrives. And then very small down here at the bottom, but I've highlighted it in red, is in the state of Massachusetts, there's what's called the Good Samaritan Law, which basically protects people who overdose as well as those who are responding to their overdose from being charged or prosecuted for drug possession. Now, the DA probably knows a lot more about the legal things than I do, but basically the intent of this law is to sort of increase the chance that bystanders will call 911, right? We want people to get help, we want people to survive. And then just the 3 exceptions that I always let folks know about that, could get someone in trouble at the scene would be weight, if they have enough drugs on them to be considered distribution as opposed to simple possession, if they have outstanding warrants or weapons on them at the scene. But I think it's really important to note that, that law does protect folks who are responding to an overdose. Next slide, please. So this is sort of the nitty-gritty of how to administer Narcan. So in the state of Massachusetts, there's a few different formulations of Narcan. Today, we're just focusing on the nasal spray because that's what's most common here in Massachusetts. And I think it's sort of the easiest for lay folks to use. So Narcan comes in just a little sort of foil package. So you're just going to peel open that package. And then if you look at box 2 in this image over here. It's a little nasal spray. So you're gonna, put your index and middle finger on the top there, thumb on that plunger on the bottom. And then that top part will go into the person's nose. So you just want to put it up into their nose until your fingers are touching the bottom of their nose, and press the plunger basically. As you're putting that in, you want to make sure that their head is tilted back, so that the medication can actually get up into their nose. It doesn't end up just dripping right out. Yeah, push the plunger, spray the dose. You don't need to do anything fancy. You don't need to like split it between 2 nostrils or worry about anything like that. It's just 1 push, 1 dose. Underneath in red here, just don't test the device before use. You don't want to make sure, you don't need to, you don't want to waste any of that medication. And then bold underline over here, I note that you're gonna need to wait about 2 to 3 minutes for that Narcan to work. That's about the amount of time it takes for the Narcan to be absorbed by your body, to get up into your brain and do the thing it has to do. Really encourage folks to wait those 2 to 3 minutes before giving an additional dose, because no matter how much you pump in at one time, you're still gonna need to wait those 2 to 3 minutes before it works. And then you're just sort of increasing the chance that that person's going to feel really sick when they wake up. 2 to 3 minutes, I say it now, sounds like not a long time. It can feel like a long time in the moment. So I just want to acknowledge that. And then if we go to my next slide, while you are waiting those 2 to 3 minutes, what you can do to help that person, if you're comfortable, is do rescue breathing. So, it says on the slide that this is really to make sure that they're getting oxygen to their brain. One of the things that we worry about when someone is not breathing and their brain is not getting oxygen is the chance for like long-term like traumatic brain injuries, basically. So in order to do rescue breathing, you're going to have the person laying flat on the floor, on a table, wherever is convenient. You're going to want to tilt their head back slightly, as you can see in this image here. You don't need to like, crane their neck backwards, but basically you want to make sure that their airway is nice and open. So you're going to tilt their head back, lift their chin, cover their mouth with your mouth, and give them 2 full breaths to sort of start it off, then 1 breath every 5 seconds. So thinking about just like normal breathing pace. A good way to know if you're doing it right is you should be able to see their chest actually rising and falling as you are breathing for them. Note over here, it says to sort of check the airway for any objects. So, if you see something like super obvious in their mouth that you can easily grab, absolutely take that out. If it's farther back in their throat, it's not easy to pull out, don't, because you will just risk pushing it further into their throat. So at that time, you would just want to wait for emergency personnel to come. Rescue breathing can be exhausting. So if there's another bystander there, you might want to take turns doing the breathing. For your business, you might want to consider in your first aid kit. They make little plastic breathing masks. I should have brought one with me in this room, but I don't have one handy. But it's basically just a little plastic sheet that you can put over their face as you're breathing for them to sort of be a barrier, basically. Rescue breathing also always sort of the comfort of the person doing it, right? If they feel confident and comfortable doing it. We generally don't recommend doing chest compressions, like sort of the full CPR, unless that person doesn't have a pulse, because sort of the main thing that we worry about is, oxygen getting to their brain. That said, if you are fully trained in CPR or are more comfortable doing chest compressions, and that's what you would rather do over rescue breathing, go for it. It can still provide some stimulation. It does sort of push on your lungs, which can help, but sort of rescue breathing is sort of the gold standard. That's what we recommend. Next slide. So that's sort of the gist of it. So you're going to be, giving the Narcan, waiting 2 to 3 minutes, doing rescue breathing or chest compressions to your comfort level. If they don't respond after 2 to 3 minutes to that Narcan, absolutely give them another dose. I will say here in Framingham lately, we have been hearing that folks are taking like 2 to 3 doses of Narcan for revival. There are some really strong opioids out there these days. So always good to have a couple on hand if you can. The kits that we usually give out come with 2 doses in them. So you've been giving the Narcan, you've been doing your rescue breathing, you're waiting for EMS to arrive. Hopefully the person wakes up. My pro tip here is to be cool. Be kind, be compassionate. A person might not realize what's going on. They might be disoriented, they might be scared, and they'll probably not be feeling their best when they wake up. So it's not the time to, yell at them or ask them, what's going on. You can talk about that later. For now, just giving them some space, explaining what happened. Hey, I think you might have had an overdose. I gave you some Narcan. EMS is on their way. They're going to come and check you out. How are you feeling? Are you okay? I don't know if this is super applicable in like a business setting, but just for your information, the person may want to use again because they are not feeling well. They're experiencing withdrawal. Like we mentioned earlier, just show compassion and sort of try to write it out with them. Again, let them know that they will feel better once that Narcan starts to wear off. If for some reason you have to leave, like if it's just you two and you have to run to get the Narcan or to find EMS, you're going to want to put the person in the recovery position if you have to leave before they're like fully up and alert. So the image over here shows sort of how to put someone into the recovery position. So basically you're going to have them flat on the floor. You're going to extend one of their arms up over their head, put their other arm under their head and roll them onto their side, sort of like if you're a side sleeper, I guess. And then have their top knee on the floor, as you can see in number 4 over here. Basically, the idea with this position is you want to keep them in a stable position. So that knee helps keep them stable on their sides. They're not going to roll onto their stomach. And because they're on their side, not on their back, if they do wake up or if they throw up, they're not going to choke or anything. So it allows them to keep their airways clear and breathe. So Narcan, like I said, it's sort of a one thing only, one trick pony. Narcan only works on opioid overdoses. So when we're talking about opioid overdoses, we're talking about things like heroin, fentanyl, prescription painkillers like Percocet, Vicodin, things like that. Narcan does not have an effect on other kinds of drugs. So it doesn't impact cocaine, methamphetamine, benzos, which can sort of present in a similar way. So things like Xanax or Klonopin. So just keeping that in mind. That said, one, we do know that a lot of drugs are being cut with fentanyl. So there may be sort of multi-drugs happening here. And also you might not know what the person is using. And so we would always recommend giving the Narcan. But that's sort of been one of the important reasons why we want to make sure we call 911 just in case there are other drugs being used or just other medical conditions going on. I think that's my overall, and again, feel free to pop any questions in the chat if I went too fast through anything. And then just a little plug for program Rewires. So like I mentioned, we're in Framingham, Massachusetts, and we serve a few different towns in the Metro West. And in general, we love hearing from folks, so please feel free to reach out. Actually, I'm going to put my contact info in the chat right now. So we do all kinds of stuff. We're what's called a harm reduction program, which really just means that, we meet folks where they're at, right? Like to make any positive change related to their drug use. So for some folks, that means, preventing HIV and Hep C, overdose prevention and response. We are here and can absolutely support folks if they do want resources about, detox or recovery. I like to joke that really whatever people need, we do our best to try to help them with that. And if we can't help, we try to point them to someone who can. So we offer free and confidential delivery of Narcan as well as other safer drug and sex use supplies. We do trainings like this all the time. We do syringe access in Framingham and Natick currently. We have a fabulous mental health counselor here who works with a lot of our participants. And then other programs that happen at Program Rise, we offer HIV and Hep C, STI testing and counseling, PEP and PrEP, which are HIV prevention medications. We do case management and peer support for folks living with HIV. in the past couple of years, we've been doing COVID-19 vaccinations. And we have a program here called GLASS, which is a programming for LGBTQ plus people of color, especially youth in particular. So all kinds of cool stuff over here. Yeah, thank you guys again for having us. I hope this was helpful, and feel free to reach out anytime.
Great. Well, thank you so much, Amy and Audrey. Both of your presentations were excellent. I'm just going to quickly go through a couple of slides of resources. Again, you will get a link with this full program, so you don't have to run around trying to write these phone numbers and these websites down. You'll have full access to everything in the training. We have a number of, Massachusetts and Massachusetts resources. We have support groups. And then this last page is some resources for the workplace cost calculator, but also the Massachusetts Clearinghouse provides free resources to businesses and to groups, all kinds of community groups regarding drugs and alcohol. And so it's a really great place to get some material for your workplace if you want to make sure that people know that you understand and support recovery in your workplace. So with that is our presentation for the day. I'd like to thank everybody for coming. Have a great day. Thanks.